Every nation will take steps in their own national interest to protect their people, and we must be respectful and cognizant of that.
COVID-19 is an evolving situation which we need to internalize into our lifestyles. I can understand that with regard to a specific variant, there are certain specific precautions which need to be taken temporarily. But de-horse that specific situation, if you look at the entire global paradigm of travel, every country has different sets of restrictions which are in play despite the vaccination or the number of vaccinations going up almost globally. What I wanted to ask the minister, that between the World Health Organization and the International Civil Aviation Organization, can't a minimum standard operating procedure be evolved whereby, passengers who have been vaccinated do not have to go through repeat RT-PCR tests when they travel, or there is some kind of uniformity, some kind of a synchronicity which is established? Would the minister be willing to take some kind of an initiative in this direction so we have certain uniform global rules emerging with regard to this travel?
I think the member's suggestion that the ICAO, the International Civil Aviation Organization, work with WHO, I would like to apprise this House that COVID is a pandemic that the world has not seen in the last 100 years. And therefore, it is difficult to say that WHO and ICAO should mandate a uniform rule for nations across the world. Every nation will take steps in their own national interest to protect their people, and we must be respectful and cognizant of that. Having said that, it has been our effort over the last 6 months or so to slowly increase our flights internationally as well. As I mentioned in my previous answer, we have now started with Singapore on the 29th of last month, and Singapore Airlines now comes into Bombay, Chennai and Delhi. We have 2 flights each into each city. We have also renewed with Canada lately in the last 2 or 3 months, starting 22nd September. The US only allowed diplomats and students. Now, even for tourists from the 8th of November, that process has started. But having said that, Omicron is certainly a setback. It is a setback because all countries across the world need to be safe and secure. That is our first priority. And therefore, different countries have put in place different yardsticks. I think the yardstick that has been put in place by our government, with putting 11 countries marked as at risk and testing them completely, is the right way to go. As far as the double vaccination suggestion that has been given by the honourable member, may I also apprise this House that double vaccination does not give us 100% immunity. There are still breakthrough infections that take place even after double vaccination. And if breakthrough infections take place after double vaccination, you yourself may not be very badly harmed, but you have the capability to spread the disease. And therefore, we need to take steps that ensure the safety of our citizens in our country, which is why our government has taken the steps that have been dealt and spelt out in the circular of 30th November 2021 by the Health Ministry.